Hey, Dr. McNamara here, and today I have Rich here, and he's going to help me show you guys what a drop table adjustment looks like. Now, when I'm using a drop table, especially in this area, in the mid-back, a lot of times it helps if the patient has a lot of muscle guarding or any type of previous injury that's not allowing them to fully relax for the adjustment. This uses gravity to help beat that muscle stretch reflex a little bit. So, based off the examination, we have a nice little spot right here we're going to adjust. And it's gonna make a loud noise, but go ahead and take a deep breath in for me, Rich. As simple as that.